So we're talking about another component of the proactive referral, which is the offer. And again, when we step back and look at the big pieces that we're training into our staff members, we're talking about need. That was its own separate category. And we talked about time, how to handle time, because time and money are the obstacles. So we want to establish need first. We never start talking about time or money before we establish need. If they start bringing in time or money, we put them on hold to go back to need. So we always establish need before we leave there to go to time or money. Your staff member has to be trained in that. After that's established, we have need. Then we're going to minimize the obstacles of time or money. Now, time was handled in a separate video, and we're going to talk about the money part now, which is the offer. So what are the components of the offer? So remember, we're trying to lower the barrier to entry for this. This is the proactive referral offer. This is a very specific referral. It's a high introduction, high trust, high awareness category, and we're doing a third-party book. So it's a very unique dynamic. So when we talk about the offer, here's the components of the offer that you want to put together. Is there always has to be a why. When you make an offer, there has to be a why. And remember, when we talk about whys, there's 4 categories of a why. You do it for money, personal gain, conviction, or duty. So when you make the offer, you always want to revolve the offer around duty, because nobody wants to help you to make more money or for your personal gain. They don't care about that. But if it's for a higher calling, which is called higher third-party trust, higher calling, that's called duty. So number 1 is we want to wrap the offer around a duty of why we're doing this. Now, that should be part of your mission statement, essentially. In other words, your mission statement should have been a statement of duty. So why? Now, obviously, we're going to tailor the why to this particular category, which is the referral category. So the second category after the why is detailing the components of the offer. So now we want to itemize the components of the offer. And let me kind of give you a little example. Instead of saying an examination or a free consultation or a free examination or free x-ray, that doesn't create as much value as if you segmented it. And I'll give you an example here. So instead of a free examination, you might say it includes a free range of motion analysis. It includes a free muscle test analysis. It includes a free nerve function analysis. See, all of those are part of an examination, but when I itemize them out, because we will do all of them anyway, that's what will be in the examination. But when we itemize them out, it creates more perceived value is what it does, okay? So components, we want to itemize the components of the offer, and those are some examples. And then you always want to do the comparative price. In other words, when we give the offer, we're going to itemize out several items, which is going to, just having several items is going to give the perception of value. Also, when they're segmented out, it gives the perception of value. And then also, when we tell what the normal cost for those items are, it gives the perception of value, especially when we tell them what it's going to cost them. And we will make it this is called a price juxtaposition. That's what it's called in marketing, a price juxtaposition. So we're saying, you get this, and this, and typically this costs this, this costs this, this costs this, and then for the sum of all this, and then I come down here and I go, but you get it for this. Now we just created a tremendous perception of value. Again, that's called a price juxtaposition. So we want an itemized price. So it might say, which includes a range of motion examination. Typically that's $45. It also includes whatever your price is. One thing about price is it can't be exorbitant. You can't make it exorbitant to make it seem like they're getting a way better deal, because when people see it as way more unrealistic, you just lost trust, and that's the number one factor in the relationship. So you can't just blow up the price. It has to seem real. And so typically if you itemize out these units in what are considered realistic prices, but when you add up a lot of them, it creates a tremendous perception of value. That's the psychology and the dynamic behind it. Instead of them, range of motion exam, typical price $5,400. No, you just lost. You just lost in the whole relationship. The trust is over. So you want to itemize out the price, and then we talked about the detailed of the offer, and then the price. So what we're looking at is why you're doing it. What are the components of the offer? What does it entail? What does that entail? And then what's the price? So those are going to be the components of the offer. And then of course there's the offer. Now, in addition to that, there's always a bonus. And remember, we're always going to tie in and when we talked about bonuses before, we always are going to want to tie in a limitation of amount or a deadline with a bonus. And we want the bonus to be perceived as valuable, something that somebody would want, not just a giveaway. Because that's what we want to take away, because that's what's going to create the call to action. That's what's going to create the impetus to act, is they know that this is valuable and it's going away because it's either limited in amount and other people are going to get it before you, or there's going to be a deadline and you're going to lose out on it. So that's the call to action. So those are the call to action or factors that we're going to consider with the bonus. So those are the factors that we're going to consider when we put our offer together. And for the proactive referral offer, the category that I want that this should be under is it an introduction to chiropractic? Because that's what this is. This is an introduction to chiropractic to see if it benefits that person. So that's how I'm going to title this, because that's exactly what this is it's an offer of an introduction to chiropractic to see if it will benefit your X, back pain, neck pain, whatever your problem is. That's what it is. And so we call it exactly like that because that's the positioning of the referral. Many times these people haven't been to a chiropractor before and they don't know if they can or can't be helped. And that's what that's about. It is an introduction to see if they can be helped with their particular problem. So that's why I like to call it what it is. In other words, we state the obvious. And anytime you state the obvious, it always lowers defenses and resistance, and it makes common sense. So that's what we're going to do with the offer. So when we make out our offer, and it might sound like this, and I'm not going to, I'll just kind of fill in a couple things here. Not that this would be your offer. So the offer, now remember, we've already established need, we've already established time. I'm now going to help you use the offer to minimize the barrier to entry of price. Those are the obstacles. So we've dealt with need, we've dealt with time in separate videos, and so now we're helping to minimize or eliminate the obstacle of money. And so it might sound like this. So we're already have gone so far with this referral. Remember, this is a proactive referral that we're talking about. It's very specific. So it might go with the offer. It would go something like this. Say it's Mary, and we're talking about her mother. Her mother has neck pain and headaches. So Mary, what we'd like to do is offer you our introductory offer. And it's to see if chiropractic can help. And the reason we do that is, quite frankly with you, is a lot of patients have problems and they don't even know if a chiropractor can help them or not, to be honest with you. So we'd like to offer an introductory offer to your mom to see if chiropractic can help her. Now, the reason we do that is, and now it's our mission statement, is whatever your mission statement is, we're here to help the community and our members in our community to relieve back and neck pain and help them have fully functioning lives. That's why we do this. So whatever your mission statement is, and it's very simple, straightforward, clean, just something like simple as like that. That's called duty. That's a higher sense of duty. And then from there, and so the offer includes a consultation. Now that consultation is broken down into a couple parts. Number one, we're going to go into the history. Well, how did the neck pain start? Number two, we're going to go into the family history. And then we're going to go into the current history. So there's three categories to this history we're going to look at. Typically, that history, that consultation and history in all three of those categories, that might be $95, Mary. And then typically after the consultation, we'll do a couple components for an exam for your mom. We'll do a range of motion test with the neck. Typically, that's only $45. We'll check the nerves in the neck. Typically, that's $45. We'll check the um, um, range of motion, the muscle strengths in the neck, and that's $45. So all three of those can end up being about $150 roughly, give or take, in addition to the consultation. So that's what the offer includes. Now, there is a bonus. Now, unfortunately, there's a limit with the bonus. We only have 10 bonus options, and there is a 10-day limitation for the bonus. Now, in the bonus, we're going to include, and again, I'm not telling you that this is what your offer should be. I'm just giving you an example of how it would say. So the bonus would include, not only, it would include one therapy. Now, typically, the therapy we're going to use is a therapy to help decrease pain. That therapy, and it's called muscle stim. So that therapy typically is $45. And then we're going to offer a analgesic gel. It's called BioFreeze. And typically that's about $45. And then also as a bonus, we're going to offer a 25-minute neck massage. And that's typically about $45. But you get the idea. It's not necessarily 40, but you get the idea with the money part. So the bonus, unfortunately, that because of the time and effort involved with that, we do have to limit that. So there's only 10 available, and we only have a few available left, and it's only good for 10 days. So that's what the offer would sound like. And then I would do a call to action on the offer. But that's how I'm going to make the offer. That's the formula for making an offer. Now, it's pretty easy because it'll be consistent. Once you put your offer together, it's the same offer. It's the same offer. Now, remember, with offers, people like buffet. I call them buffets. They don't like a la carte. A la carte confuses people. That's why you see all the restaurants, they went to, give me order number 1, give me order number 2. Okay? People actually order more, and it's less confusing. So that's why you want to make your offer as a buffet, not an individual component. And then a lot of times we like to include, a couple treatments, lower the barrier to entry, and whether it's a couple treatments or no treatments, or excuse me, couple treatments, we want to include treatments because we want the process to start. We want the communication, the patient education, the comfort. We want that process to start. And so we're going to lower the barrier to entry. So that's some of the components of how to put together an offer with the proactive referral.